So welcome to Rogers Madison. This is our front desk area. So this is where patients are greeted.
We really see a pretty quick recovery for a lot of people, and that's very nice to see. I think a lot of patients are surprised when they come out of our programs that they've made that much gain.
And one of our patients wrote to us and said, "To all of the staff, I wanted to take a moment to recognize all the amazing people I met during my stay here in the program. Every member of the staff was extremely professional, caring, and compassionate towards me." It's wonderful to get that kind of feedback, to know that what you're doing is really making a difference in people's lives.
We really focus on evidence-based treatment, regardless of what the diagnosis is. Really trying to use the treatment that best fits each person that walks in the door.
So there are patients working individually in these rooms.
We provide a unique level of care that I haven't been able to find in other places. So it's a really exciting place to work.
Really nice group space here for our eating disorder patients.
They're here and it's intense, but it's supportive. But then they leave for the day and they have to go outside and deal with maybe the spouse that isn't supportive, or the job situation, or beltline traffic. And then they can come back the next day and we can kind of talk about how they managed it and maybe improve on some things, maybe support other things. Patients find that to be very beneficial.
We have programs that specialize in OCD and anxiety disorders, and PTSD, depression, eating disorders. And we have OCD programs and dual diagnosis programs, both for children and adolescents. You know, we're going to do whatever we can in working with their kids and working with them and working with their schools to meet their needs wherever they're at. And I think that's part of the benefit of our programs too, that we have this individual and group-based model. We're having family sessions regularly. We are doing things like Parent University to try and help the parents out and be educated about what their children's issues are, to help them in their home life. So even when they leave here, they know what to do to help with their kids' mental health concerns.
So we also have an kitchen for our eating disorder patients, where they can have breakfast, dinner, lunch together.
You know, oftentimes we have people coming in with PTSD who have also are struggling with eating disorders or struggling with OCD, and they might have gone to somebody to only treat the eating disorder or only treat the OCD, and that level of care didn't work for them. So coming here, we have experts in the field that we can kind of go to that are right down the hall or right upstairs. So the fact that we're able to incorporate all of those other specialties as well is really a unique situation.
We're going to be supportive. We're only going to start with things that are difficult yet manageable for them. So it's not going to be like we're throwing them into the most difficult thing they can imagine. We're gradually working towards their goals and their family's goals.